Okay, everyone, it's 12:30. We'll kick off today's webinar. I just want to say thank you for everyone for joining today's webinar, which will focus on managing patient profiles and clinical records. And it's the third webinar in our new onboarding series. So we really appreciate you coming today. My name is Shane. I handle the marketing here at Halaxy. So if you've seen some of our emails, Facebook posts, or anything like that, that's most likely my handiwork. And I can see from today's webinar, there's a few familiar faces from our previous webinar. So that is always good to see. As I mentioned, today's webinar will look at some of the more advanced clinical features and functions that you can use to turbocharge your practice with Halaxy, including how to manage patient profiles, set up patient funding, create and send patient intake forms, and how to overall streamline the clinical work you do when you use Halaxy, some of the really important work you do. So we'll look at how Halaxy self-solves some of the common problems that many practitioners and administrators face every day, including how to automate technical and repetitive clinical work, how to easily organize client files and data in your practice more generally, how to automate the collection and updating of patient information. We see this as something really important for our practitioners using Halaxy, and how to just streamline your administration to manage your practice's patient profiles and clinical records. By solving problems like these, Halaxy doesn't just reduce your administration and clinical work, it automates and removes it, saving you up to an hour of work every day so you can focus on what really matters most, that's patient care. But before we launch into today's webinar, I thought I'd take the chance to ask everyone a few questions that can know you a bit better. So I was just wondering, what is your role within your practice? What do you currently do at your practice? If you can just drop the answer in the chat, that would be great. We have a clinician, practice manager, very nice. Administrator. This webinar is perfect for all of these roles, whether you're on the admin side or on the practice practitioner side, we're going to be able to help you out. And I guess another question I just want to ask everyone is, what are you most interested in learning about when it comes to managing patient profiles and clinical records in Halaxy? Or put another way, what attracted you to join this webinar today? Admin support, very nice. Wanting to be more efficient, that's great. We're going to help you with that. Behavioral support. Intake forms, yeah, we see a lot of popularity with intake forms. Reduce admin, we're going to focus on all of these today. Okay, well, thank you everyone for your answers. At the end of the day, like I said, whether you're a practitioner or an administrator, Halaxy can be customized to your practice and your profession. And our main software is 100% free. There are no 30-day trials, memberships, or contracts, and you can start using Halaxy immediately and for as long as you like, which includes all these essential features to help you run your practice, including everything you need to know to manage patient profiles and clinical records. That's what we're going to go through today. Okay, that's enough from me, enough marketing. Let's dive into today's webinar. Over to you, Ria.
Hang on, I'm trying to show my video and I can't. Give me one sec.
No, that's okay. We all have technical problems sometimes. Thank you, Ria.
Okay, I found it. Yeah. Hi, everyone. Sorry for that. My name is Ria. I am the content and learning specialist here at Halaxy. So I'm in charge of the help guide. I help with onboarding and just making sure everybody knows how to use Halaxy. So I'm really excited to be here. Our webinar focus is managing and treating patients, like how you do your clinical work. And we are building on the main features that we've discussed in the previous webinars. So we had our getting started webinar and we had our scheduling webinar. If you didn't attend any of those, Shane is dropping a link to the webinars page in the chat right now. So we trust you're familiar with the basics as we delve into more advanced topics. So now I'm going to talk about the learning goals we have for today. Our first one is how to manage patient profiles. So we're going to introduce you to the patient profile and all its features. We'll simplify and customize the way you want to manage your patient records. How to manage access to your patients. This is especially handy if you have multiple users in your practice. Also, how to add emergency contacts, care team members. The next topic is how to set up patient funding. So when you enter, like in Halaxy, when you enter your payment and claim info, you never have to enter them again. This allows you to automate your invoicing, your payments and rebates, so your patient's correct details are always going to come up. And also how to accommodate other arrangements, like if the patient is a dependent, If you need additional claimants on Medicare, that's part of it. The third topic is how to create and send patient intake forms. So you can save time by letting your patients complete their own profiles. You can require payment information and let them provide their claim and referral details. So all of these are ready to go by the time they come in for their appointment. And you can also send the intake form ahead via SMS or email so they can complete even before they come in. And the last topic is how to streamline your clinical work. So we're going to be touching on the basics of clinical templates. So you can record and document your patient's progress over the course of their treatment under your care. With templates, you have the clinical tools, you have clinical notes, note templates. Doing your clinical work has never been faster or easier. So just want to say, like, these are the topics that we're going to be discussing today. We have a lot of other features regarding patient management and clinical work. And if you want to check that out, you can visit our help guide at support.halaxy.com. Our help guide has all the step-by-step instructions for everything you need to use Halaxy. We also have our resource center. So if you're in Halaxy, there's a help and resources button here in the lower left. You'll find that on every page in Halaxy, and it opens this help and resources panel here. This search bar here is connected to our help guide, so you can search straight from Halaxy. We have video tutorials. Our webinars are linked here as well. And also we have a news tab, so you can stay updated on our latest features and updates. If you want to follow along, you can log into your Halaxy account, or we recommend, if you don't have one, we recommend creating one. It's absolutely free. You don't need to add a credit card or have a lock-in contract. So to follow along, you can have Halaxy open in one window, and then you have this webinar open in another window. Yeah, so you can see both screens at the same time. Also, a couple of reminders that some features in this webinar require a verified profile. This helps protect patients so that we can promote only authentic practices. It doesn't take long. To get verified, all you need to do is complete your practitioner profile and complete your practice details in your locations page. So it takes less than 10 minutes. If you haven't been verified yet, Shane is dropping a link to the help guide for step-by-step instructions on how to get your profile verified. Next, some features here will also require Halaxy credits, so such as SMS messaging. Halaxy credits are what you use to pay for add-on features to turbocharge your practice. So it's like SMS, Medicare claims processing, telehealth, calendar syncing, and e-scripts, and so much more. So Halaxy is free, but the add-on features, you just use Halaxy credits to pay for them. Credits don't expire as well, and you'll always only pay for what you use. So if you don't know how to buy Halaxy credits, Shane is also dropping a link for instructions how to purchase Halaxy credits. If you have any questions, you can drop them in the chat tab at the bottom of your screen. We have Sarisha and Rudy from the service team here to help answer your questions. And just a quick reminder, please keep your questions relevant to the topic of our webinar. If you have any complex questions regarding situation of yours, we recommend that you email the service team or you call them instead, so your issue can be resolved faster. So yeah, without further ado, let's jump in Halaxy now. Let me just get the window open. Okay, so in Halaxy, in our previous webinar, we learned how to quickly add new patients from the calendar. So you just click, just a refresher, click on the calendar, and then you add a patient here, save, and then add the fee, save, and that's the one-click workflow. So from here, whenever you add a new patient, you'll see that the patient's name is linked here, and that can take you directly to the patient profile. So if you click on the patient's name, anywhere actually, when you see the patient's name is linked, it'll take you to the patient profile. And when you open the patient profile, So because this is a new patient, it's pretty empty at the moment. But just a preview of what a patient profile can look like when filled out. It looks like this. So a patient profile is essentially a patient's health file or health record at your practice. It stores personal information, appointment history, clinical history, invoices, their funding details, and more. So quick intro, we have a few tabs here at the top. So general, this is the quick snapshot of your patient profile. Your clinical notes, this is where you create and store all your clinical documentation regarding this patient. So appointment notes, clinical tools, questionnaires. Their intake form answers are also going to be here. Clinical dashboard tracks and visualizes your patient's progress based on data that you collect from clinical tools. So this allows you to quickly see all data points you want to track and even set goals for them. Funding is where you set a patient's info and settings for their payments, claims, and rebates. Invoices and appointments just lists all their invoices and their entire appointment history. And the social history tab lists the patient's background information. So you can attach this to a patient intake form to fill out. And this can include like their allergies, their family history, medical history, active problem list, any medications they're already taking. So that's in the social history tab here. So we'll explore some of these features later. Right now, we'll talk about the general tab. So this tab has all the important information about this patient available to you at a glance. So personal and contact info, there's here you have their status at their practice, their care team can be added here at the bottom, their attendance history, outstanding balance, and so much more. So we'll go through this one by one. So if you want to fill out your patient's profile, their personal info, you can click here, the edit button here at the top right, or you can click the edit link here next to their name. So let's look at that. So this is the patient profile form. So I mean, it includes the standard information like their name, mobile number, address, date of birth. But I want to highlight some special features on Halaxy patient profiles. So the first feature would be the profile type. So you can set a patient's profile type. So for example, you have dependent and contact only. So dependent is like, let's say a child, or if you are a vet, this could be a pet or animal. This could also be somebody who needs a guardian. Basically, a dependent profile type has clinical info, but it doesn't have funding or contact. Whereas contact only, this can be like a parent or a guardian or a claimant. This has funding and contact information, but no clinical info. There's no clinical tab. But if you want, like if it's an adult patient, you need both funding and clinical, you can keep this at full, which is the default. Another feature we want to highlight is we have expanded options for gender diversity. So as you can see here, we have pronouns, sex assigned at birth, legal sex, and you can also add other options for gender. So you can set this up so if you go on your sidebar under settings and then general, if you click that, and then under general settings, you have this field here called enable additional gender related fields. So if you click the pencil icon to edit that, you can enable these additional fields. And if you have them enabled, you can also customize them, which ones you want to use. If you want to add your own options, you can also do that. So that's expanded diversity fields. We also have patient status. So by default, a patient is set to current, but you can also set them to like discharged if they're blocked from your practice. So for example, something like diseased and blocked, you won't see their name in your patient list anymore. You can also set them to archive, or they're due for a review. And the function for this is so that when you run your reports, you can also You can filter by patient status. So if they're due for a review, you can filter that in your reports. Another is patient terminology. So maybe not all of you want to refer to your patients as patients. You can change the terminology to client, resident, like if you are working in aged care, there's customer, participant. And when you change the terminology for patient here, it'll change everywhere in Halaxy. Like here on the sidebar, this would say clients, this will say client list, and so on and so forth. The next feature I want to highlight is labels. So labels are basically, it's a custom way to categorize your patients. So you can add like tags to your patients, and then you can filter your lists according to these labels. So you might want to see like these labels next to their name in their profiles. So for example, let's just open up a patient profile so we can see what that looks like. So if we open that here, this is what the labels look like. And you can also add labels to professional contact profiles, organization profiles. You can add like NDIS. So to add labels, you need to go to settings and then general again. And then under general settings, you have this labels field here. And then if you click view all, you can add your own labels and also color code them. So they're easier to categorize and organize here. So you can, by the way, you can only add labels that you've already, like you can assign a patient a label that you've already added here in your settings. So make sure to do that first. Another thing is alerts. So alerts are short notes that appear by a patient's name everywhere their name shows up. So this can appear in the profile, appointments, invoices. They are instantly visible and they help you, they help quickly notify practitioners and your admin staff on important info regarding the patient. So for example, here, this is an alert. It'll say requires interpreter. So you can say this can be for like they require wheelchair assistance or something. So if you look at this, how this looks like in an appointment, for example, when you open the appointment, it's right here beside the patient's name. And if you hover over the icon, so it'll show that notification. So other examples can be like, for example, if it's a difficult patient, you might want to label that, put an alert for that patient as well. So this is the patient profile. You can add in like their time zone if the patient belongs to a different time zone than you. Add your introduction source, how they found out about your practice. So once you're done filling out your patient profile, all you need to do is click save. So this is the standard way to enter patient profile info. But here at Halaxy, we've enhanced this process for you in 2 ways. So one is to send a patient intake form so patients can enter their own information. When a patient completes an intake form, their profile is updated instantly, even before they come in for their appointment. And the other way is to invite a patient to the Halaxy patient portal. So this patient here on screen, you'll see this patient is a Halaxy user. They already have, they already set up their patient portal, and it looks like this. So they can easily book appointments with you. They'll see their next appointment. They can pay their invoices. You can even share clinical notes with them. You can assign questionnaires for them to fill out. So to invite a patient to the patient portal, if we look here, the new patient, in their patient profile, under their name, you'll see a link here that says invite to patient portal. So when you invite them, they'll receive an email that takes them to their portal so they can set it up and activate it. So moving on to the other parts of the patient profile, we have our contact details here. So if you want to get in touch with a patient instantly, you just have to click like here, you click their email address and you can send an email to them. with this, you can send them an SMS, but again, don't forget that you need Halaxy credits to be able to do this. You also have some other action icons here. So this button here, this takes you to send the patient intake form. We'll get into this more later. The speech bubble icon, when you click that, this takes you to the message history. So you have your email, your SMS history. So it shows all the emails that you've sent to them. If you've already sent them their invoice, a reminder, any one-off emails, you'll see it here. And then this file drawer icon, if you click that, this is for admin notes. Admin notes are non-clinical notes that you want to document in a patient's profile. So it's typically used for logging contact with patients outside of Halaxy. So if you don't have like something outside of email and SMS history, so for example, if the patient called, get an inquiry, you can log it here. You can print your admin notes as well. You can assign it to certain people. Yeah, so that's admin notes. Next is it's standard practice in healthcare to add patients' emergency contacts. That's something that they can add in the intake form. But their contacts are going to be stored here. So you can add as many contacts as needed, but just make sure you indicate which one is the primary one. You can also configure the relationships here. You can do this in your setting. If you need to add like your own custom relationships, you can add that in your general settings. So this is where you make you tick to make this person the primary contact. And you can also enable this contact to receive reminders and campaigns. Anytime you email this patient, this contact will be emailed as well. And they can also share payment methods. So for example, if this is the patient's mother, you can enable payment methods so that this contact's credit card is going to be used to pay for the patient's appointments. And you can add any notes here as well. So you can save that. And then you also have a section to add your patient's care team. So this can be their GP, their physical therapist, oncologist. This allows you to have easy and instant access to everyone who is also managing your patient. So you can get in touch with them via SMS or email. Next up, we have an appointments overview card here. So this shows the total number of appointments they've had at your practice, the dates of their last and their next appointment, and also their outstanding balance at your appointment. Then we also have a section on practitioner access and privacy. So this section is important when handling patient profiles, especially if your practice has multiple users and you want to make sure only appropriate members in your practice have access to this patient profile. Especially since some patient profiles have very sensitive information, only specific people should have access to this. When you add a new patient to your practice, you're automatically listed in here as somebody who has a relationship with this practitioner. If you create an appointment with this patient, you'll be listed here as well. But what happens if somebody else adds the patient? It depends on your access level. So if you're a full access or clinical access user, you'll have access to this patient no matter what, regardless if you're listed here or not. But if you are on personal or contact access, somebody who has access to this patient has to share access with you. They have to add you to this list. So to do that, if you click this edit link next to practitioner access and privacy, and they can add the practitioner from this list here. Yeah, and somebody on full access or somebody listed here should be able to add you. The other thing with practitioner access is you can set a patient to private mode. When a patient is on private mode, that means only the people that are listed here can view this patient profile, including people on full access. If they're not listed here, they won't be able to view this patient or book any appointments with them. When a patient is on private mode, to any user who's not in this list, this patient is essentially invisible on Halaxy. So if a patient is on private mode, if you click save, oh, wait, sorry, let me delete this person. If you save this, you'll know that a patient is on private mode when there is a lock icon here. So they can only be accessed by the practitioners listed below. For more information about the other options on sharing access, like these fields here, we have an article in the help guide explaining all of this, and Shane is dropping a link to that in the chat now. Our next section is communication and reminders preferences. So in our previous webinar, we talked about how to set up reminders and your reminder preferences. If you have a patient who doesn't want to receive certain communications from your practice, you can set their individual preference here. Do note that they will always receive invoices, but you can opt them out of marketing campaigns or appointment reminders, especially if they request it. So your reminder settings, for example, here, this particular person has specific reminders, and you'll always stay on top of who has individual reminders by, if you here on the sidebar under settings, and then if you click reminders, you'll see that you have one patient with customized preferences, and you'll always be able to view that here. So you'll be able to stay on top of who has individual preferences. So that is our general tab. We'll be moving on to the next topic, which is to set up our patient funding. You'll find this in the funding tab. So at the top, just click the funding tab. This page holds all the information and settings for the patient's payments, rebates, and also for their claims and referrals. These are all the factors of how patient appointments are paid for. So the first thing here is you have the card details. You can add their credit card here. They can add this as well from the patient intake form. You have their bank account. So for Australian practices, if you are processing your patient's Medicare claims on Halaxy, their rebate will be deposited directly into this bank account listed here. Next, we have claims and referrals. So if you attended our Getting Started webinar, you can quickly add a patient's claim from their appointment. So if we look at that here, you open the appointment, you can add like a Medicare, their claim here. And when you do that, it automatically appears here. And it shows you how many appointments in this referral have already been used, which appointments are linked to this referral. So if you hover over the limit, so 1 out of 4 appointments attended, it'll show you the details. And same thing with this. This is an old referral. It's been all the appointments have been used up. It'll show you which appointments this referral has been linked to. Also, are there any practitioners here who have dependents as patients? In that case, if this patient has a claimant, like their parent is using their Medicare card details to get the claim, you can add them you can add the contact as a claimant. So under Medicare, look at their active next to their Medicare card number, if you click the pencil icon, you can click the button Add Claimant, and then you can add the parent, the claimant's Medicare card details here, and then just click Save, and the rebates will go to the claimant. Yeah, and just like the patient profile and the card payment details, claims and referrals can be added as fields in the patient intake form, so your patient can enter these details themselves. And that's what we're going to be doing in this next topic, which is to create and send patient intake forms. This is one of Halaxy's most popular features, and quick trivia, intake form is the most searched term in our help guide. So intake forms are standard in healthcare. It allows practices to request and record patients' info. This can typically include their personal info, contact details, their emergency contacts, Medicare info, consent to treatment, and more. So Halaxy intake forms are fully customizable, letting you request and capture everything from card payment details, any file uploads, anything you need. You can add custom sections and questions, even attach standard clinical tools and questionnaires that you want the patient to answer before their appointment. You can create as many intake forms as you need because not all appointments are the same. So for example, if you have an initial appointment, you might need to collect payment info. You have an intake form that requests payment information. And you might have follow-up consultation appointments, and you won't need to request payment info for that anymore. So you can have a separate intake form for that. Or you have some specific services. Some appointments might be for specific issues. For example, they need specialized questions like for treatment for smoking, something like that. You can have different intake forms for different appointments. You can send an intake form via SMS or email. It contains a link that takes the patient to the form in a secure page, and the patient can complete the form on their device, including a mobile phone. When the patient completes and submits the intake form, the patient profile is automatically populated with their details. And you can also automatically send intake forms at a schedule, for example, 3 days or 7 days before their appointment. Or you can manually send straight from their profile. So just a reminder, you need a verified profile to be able to send emails and SMS to patients. So first, in this topic, I'll show you how to create a standard patient intake form, and then I'll show you how to send it to the patient. So to set up an intake form on the sidebar, sorry, I'll show you on a new profile. So on the sidebar, click Settings, and then General, and then scroll down to the bottom of the page. Under Clinical Settings, you'll see Patient Intake Form. So click the pencil icon next to that. And this is where your list of patient intake forms will be. Halaxy provides one by default. You can create your own by clicking Add Form here at the top right. But let's just set up this existing one. So click that. We'll name this intake form, like say, this is for new patients. You can add a description. This is purely internal for your team to see. If one day you're not going to be using this intake form anymore, just set the status to archive, but let's leave this inactive. Next, we're going to select the standard sections that you want to add to your intake form. So patient details will include standard personal info. So your name, date of birth, home address, email, phone, and emergency contacts. By the way, just a pro tip, Halaxy pro tip. If you're not sure what a certain field means or what it's requesting from you, just hover your mouse over this question mark icon here. That's a tool tip. It'll show you more info on what this field means. So for example, here, you want to know what patient details includes, just hover over that and it'll show in a tooltip. So we'll add that. Next, introduction source. This is like how your patient discovered your practice. Can include card payment details, and you can also require card payment details. So this way, if the patient adds their credit card details, you'll be able to process payment instantly, like after the appointment. You won't need to chase up payments anymore. You can include their bank account details so that their rebates will be deposited there. You can include a patient social history form, and you can also include claim and funding information. So from here, you can select Medicare, so they can include their Medicare card details, and it'll automatically update in their funding tab. And the referral details if they need to include one. So you'll also see here, there's another column. This is file upload. This is so that you can allow the patients to upload a file. So for example, with referral details, I'm going to tick that checkbox here, allowing them to upload the file because I want them to upload the referral letter in the form. Next is manage templates. So if you have any clinical tools or clinical note templates that you want them to fill out, you can add that here. Like, for example, a DAS-21, any kind of questionnaire. If you've imported this in your practice, which I'll show you how to do later, you can attach that here so they can complete it. It'll show up in the form in its own separate page. And you can also attach files. So if you have a pamphlet or flyer or anything that you want to send to the patient automatically with your intake form, you can attach it here. So that's the standard. These are the standard sections. If you want to add more of your custom questions to your form, you can do that. You can add sections. So if you add a section that's going to appear on its own page, and then you can add as many questions as you want in your sections as well. So you can also make certain questions conditional. So for example, you'll have a question that's like, are you taking any medications? And if the patient answers yes, there'll be another question that appears like, which medications are you taking? And then they can list that out. So you can reorder, edit, delete your questions. You can add as many sections and questions as you need. And when you're ready, you can save your intake form. So if you want step-by-step instructions on how to add your own sections and questions, Shane's dropping a link to the help guide for that. So let's save this intake form. Okay, so now we have our intake form. We'll need to send this out. So there are two ways to send a form. There's manually or automatically. Manual is just send individually as needed, and automatic is to send it at a set schedule. So for this webinar, I'm going to show you how to send manually. To send automatically, we're going to show this we're going to demo that in our automations webinar next month. So I will show you how to manually send. So before we go into sending, this goes hand in hand with another one of Halaxy's features that can save you time, which is communication templates. So if you want to send out your patient intake form via SMS or email, you will need to have content for that email, and you don't want to keep recreating that email from scratch. One of the most tedious parts about admin work is repetitive tasks, especially like messages that you need to keep copy pasting or typing up from scratch. So in Halaxy, we have communication templates that can be reused, and they're also automatically personalized. So to create your own communications templates, again, in the sidebar under settings, click general and scroll down to the bottom. Under clinical settings, you'll see communication templates, and just click the edit icon here at the top. And you'll want to create an email. We want to send an automatic, we want to send the intake form via email. So let's click add email, and let's call this intake form email, and then new patients. So subject, please complete your intake form. This is going to be the subject of the email. And then you can add in your the content. So with content, I want to we mentioned this in a previous webinar, dynamic terms. So dynamic terms are a quick way to personalize every email that you send out. So for example, you want to say dear, and then you don't want to just say hello or hello patient. So we'll click dynamic terms, and we'll say patient first name. So this will automatically personalize the email to your patient's name. And then it'll say, thank you for booking an appointment. Please complete your intake form. And if you're going to be sending out the patient intake form, you need to actually add in the link. So to embed the intake form in your email, the intake form link in your email. Sorry, let's look for that. look for this dynamic term called online form link and insert that here. And when you send this email, that's going to convert into the intake form that you set up. So thank you. And then you can even use a dynamic term for yourself. So practitioner, practitioner first name and practitioner surname. So it's going to come from you. So you can save that. And then, so now we are ready. We have our email template. We're ready to send this to our patient. So let's go to our patient. What's the other one here? So from the if you open the patient profile, we have this intake form icon here. So if you click that, you have two options. You have email or SMS. We'll go with email for now. And then under intake form, select the intake form template that we set up. And then under here, if you scroll down, there's communication template. So select the communication template that we created earlier. And as you can see, the subject automatically filled out and the content also filled out. And the patient's first name has already been added here. And even your practitioner name is added here. So with communication templates, like anyone can use it and it's automatically personalized. So we'll just send that. And that intake form is sent to your patient. So to see what that looks like, it's gonna look something like this. I did this earlier, by the way. So that online form link dynamic term, it converted to the actual link. So if your patient clicks that, our intake forms are protected by two-factor authentication. So they'll need to add a verification code. So let's just quickly get that. And we'll add that here. So this is what the Halaxy intake form looks like. So they can complete this, and then once they save, it takes them to the next page. And once they mark it complete, their patient profile is then updated. So that's how you manually send one by one. So this is recommended if you prefer to have control over when to send intake forms, if you just want to do it one by one for each patient. But if you have a large multidisciplinary practice with many patients, manual sending can be really time consuming. So at Halaxy, we love to automate your time consuming tasks. You can automate the sending of patient intake forms at a set schedule. So for every patient, like their intake form is going to be sent to them 7 days before their appointment. So this way you never forget to send them out. This will be one of the things we'll demo in our automations webinar next month, as I mentioned. But if you want to learn how to do it now, we have step-by-step instructions in our help guide. Shane is dropping a link to that now in the chat. Thank you, Shane. And then, okay, so now we've booked our patient for an appointment. We've sent them an intake form. We've set up their profile. We have entered their funding info. So now your patient shows up for their appointment. We'll want to document their problems, their treatment, their progress. So we're going to move on to our next topic, which is how to streamline your clinical work. So in the patient profile, click the clinical notes tab here. And this is where all your appointments are stored. Another way to access this is when you, from the calendar and you open the appointment, whenever you create an appointment, you have a clinical note that is automatically created. If you click that, that's going to take you straight to the clinical note for that appointment. So just back here, when you... So this is a basic clinical note. You have an editor here. You can add in your notes. Just a question for everyone here. What is your preferred way of doing clinical notes? Like, do you like to just free write? Do you have a preferred format or structure? Do you use SOAP notes? Do you have a questionnaire or a form that you use? Using SOAP templates, formats, yep, set of templates. Okay, free writing and templates. Wow, it really shows that every practice is different. Okay, I have a format. So yeah, every practice is different. So this is precisely why Halaxy is built to be customized to everyone's preferred way of working. So again, yep, this is a free writing thing. And then once you're done adding your notes in, next to the save button, just click this down arrow and then click publish. When you publish a note, that just disables the editor. And that means you don't get any accidental overwrites. And it also saves your content. You can always revert a published note. So just click revert here and it'll go back to draft. So of course, if you have a preferred structure, it may be tedious and time consuming to keep recreating it from scratch again and again. So like, let's say you have like headings, right? Like problem, and then let's say diagnosis, and you don't want to keep repeating all of this. So if you have standard formats of documentation, Halaxy offers clinical templates to standardize, personalize, and speed up your clinical work. Templates are basically reusable clinical records. You can import them into your clinical notes in just one click. And this leaves you only the work of filling in what's needed. So I saw somebody earlier say that they use SOAP notes. So we have a template for that. And by the way, just a reminder, you need to have a verified profile to import our preset templates. I really encourage that you use them. We have hundreds of them, so you don't have to create them from scratch. So to use a template, in the editor, you have a toolbar and you can click the templates button here. And sorry, this is from the last search. You'll see that we have hundreds of templates that you can add here. So let's say you like SOAP notes, you use SOAP notes. You just search for SOAP and then click SOAP notes. And the content of your note is then replaced with this. So you can use this over and over with other appointments. Yeah, so you've imported it, it's here, and then again, when you're done, just click publish, and then it's here. Yeah, you can prevent any accidental overwrites. So clinical note, the note templates, such as the SOAP notes, these are text-based inputs. So like the basic free write, anything you can edit here in the editor. So some other examples of a clinical note template would be treatment reviews, referral letters. So let's try another one out. So let's try the treatment review letter. And you click that. You'll see that this treatment review, it uses dynamic terms as well. So this way, this will always be populated with the relevant information that's relevant to this patient, to this appointment. So for example, this for this, the referrer, the referrer's name will be populated here from the referral that was used in this linked appointment. Their practice name, their address will be put here. There's lots of other dynamic terms you can use. So the patient's first name. So if you have a treatment review, all you'll need to do here is just put in your clinical summary and your recommendations. That's basically it. Any practitioner can import this. Their name is going to be here. Patient's name is going to be here. So the dynamic terms will automatically personalize the note. They convert to real data. So it really doesn't matter who uses this. If you want to see what that looks like, you can publish the note. And you'll see that it has populated, the dynamic terms have converted. And then you can also email this note, you can print it, you can fax this note if you have a fax integration. Yeah, so no one ever has to type this letter up from scratch. All you need to do is just import, then fill in what you need. So talk about time saved. The other kind of clinical tool template, the other kind of clinical template is the other type of clinical template is a clinical tool template. So these are used to collect and track data. So this can be a form, a questionnaire, a body chart. So some examples with this, some examples of this would be a pain chart, screening tools, calculators, scored questionnaires. Let's try one. Let's try creating one now. And let's create a new note. Up here, you can click new clinical note on the top right. And let's import a questionnaire. If there are any psychologists or counselors here, you might be familiar with this, the K10. So let's import that. So you'll see that this is a different type of template, like you can't freely type in it. It's more of a questionnaire type. And if you've imported a clinical tool that you yourself are going to fill out, so you can just answer this. I mean, obviously the patient's going to complete this, but and to calculate the score, if you publish this tool, you'll see that the score is already automatically calculated for you instantly, and it also shows you the assessment for the score. Traditionally, the way of doing questionnaires has been to print it and have the patient answer in person, or you email the file to the patient and then they email that file back to you, and then you end up with two different files. And in both these methods, you would have to manually calculate the score. Whereas here in Halaxy, you only ever need to work off this one tool, and the score is instantly calculated for you. So in Halaxy, let's just revert this back to draft. In Halaxy, if your patient is on the patient portal, you can assign them this tool and they'll complete it. They'll get it on their patient portal and then they can complete it. And then once they submit it, this tool here will be automatically calculated with their score. You'll also be notified when the patient has completed it. And alternatively, just like earlier when I showed you how to set up an intake form, you can attach this this clinical tool to the intake form so that while they're completing the intake form, they can also fill out this questionnaire ahead of time. So in this process, you didn't have to open your email, you removed having to handle multiple file versions, and you didn't even need to do any maths, which is great. So clinical templates are extremely powerful in giving you back more valuable time to focus on what matters most, which is patient care. So clinical templates have heaps and heaps of other handy features to speed up your work. We'll tackle that in a separate webinar. We're going to have a webinar in the future just for clinical templates. But these are the basics of how to use clinical notes and clinical tools. There's so much other handy features, such as like you can track your patient's progress with a clinical dashboard. You can use and reuse content using snippets and dynamic data. You can add your signature to clinical notes. You can enable clinical note locking and privacy restrictions. And you can create prescriptions like e-scripts. We will demo those in another webinar. So keep an eye out for our webinar announcements. But in the meantime, you can learn all of this already through step-by-step instructions on the help guide. That's at support.halaxy.com. And we have a section specifically for clinical records. Shane is dropping a link to that now. So we've set up our profiles, funding, intake forms, and we learned the basics of clinical templates. That's it for today's webinar. We hope you enjoyed it and found it useful. And just so you know, this session is being recorded. There will be a link to this. This will be uploaded in our webinars page, and you'll also find it in the help and resources button that on Halaxy. So yeah, from here on, you'll be managing and treating your patients with more ease and definitely with more time. So yeah. yeah, for more exciting features and functions, don't forget, go to support.halaxy.com, and I will be handing you back to Shane now. Thanks, everyone.
Thank you so much, Ria. Another session with some really great insights, so I appreciate you taking the time. As we mentioned at the start, we're now going to kick off the Q&A portion of the webinar. I know you had a lot of questions throughout today's session, but for the next few minutes, next 5 minutes or so, we can still keep answering some of your questions. So if you have any questions, just drop them in the chat, and our learning experts will help answer them. And if you have some time, we'd also really appreciate if you can leave some feedback about this webinar in the feedback form that we're linking in the chat now. Your feedback really helps us make these webinars even better than they already are. Thank you, Ria, again. So it'd be great if you could leave some feedback. Okay, we're going to work through some questions if we have any. I think we have a few in the chat. I realize the clinical side of Halaxy is quite complex, so really appreciate you taking the time to ask these questions, and for the team for answering them. We've got some questions. Is there a way to allocate a fee to a client's profile so it's default for appointments?
Ooh, that's a great idea. Currently, there's no way to allocate a fee to a patient's profile, but just so you know, our product designer is also on this webinar, so we're also going to be taking notes about your requests. Can you create your own answers to calculate results from question? Yes, you can manually, if let's say you want to have your own questionnaire, but you want to manually put a final score, you can do that. By the way, Vicky, just regarding creating your own answers, you can find the instructions for that in our help guide. Create your own clinical tools that will show you how to do a manual answer. Is there a way to close EPC payment? Sorry. Yes, handwritten clinical notes do convert to text via iPad. Yes. You customize client profiles with specific questions. Different customizations for different profile types. Oh, that's a good question. No, currently we don't. What you can do as well, Sarah, you can create a separate intake form. Are you talking about intake form or a patient profile? But what you can do is you can have a separate intake form for dependent profiles. Okay. Lynn, I'm not sure EPC payment. You like to have the school details on the front page. Oh, like in personal details. No, currently we don't have that functionality, but we'll definitely make a note of that. Does anybody else have questions?
I think.
Yeah, I just want to thank Sarisha and Rudy as well. I think they got a lot of the questions earlier.
Yes, thank you, Ria, for fielding those questions, and for Rudy and Sarisha for today's session. So we're going to wrap things up. Thank you, everyone, for your questions just now. If you have any more, you can always email them to community@halaxy.com, and we're happy to answer your questions then. So just looking at what's coming next in terms of our webinar series, we do still have a couple of exciting webinars coming up in the next few weeks that will really help you level up your knowledge of Halaxy. And just a reminder, if you missed any of the webinars we've had in our onboarding series so far, you can always view them on the Halaxy Webinars page. I think we shared that in the chat previously, but if not, you can just Google Halaxy Webinars and you'll be able to find them there. But what's coming up? Our next webinar is really all about growing your practice, really helping you organize and automate your records, including invoices, claims, payments, expenses, and even your financial reporting. If you're in charge of the billing and financial side of your practice, this webinar really is suited for you. And the last webinar in our onboarding series is all about automations and time savers, really looking at the magic of Halaxy, helping you automate your admin tasks so you can free up time to do what matters most, patient care. This webinar is great for practitioners and practice managers alike, and we'll cover time-saving processes for payments, rebates, templates, communications, reminders, and a lot more. I know that one's going to be particular fun, so I would definitely join that, as well as our 4th webinar, of course. And you can register and view those webinars shortly. Ria's just dropping the link in the chat. Thank you, Ria. But we're also going to send a follow-up email following today's session that will include the recording from today's webinar, as well as a link to our next webinar. So don't worry if you missed that link, and we're going to send that out either today or tomorrow based on some stuff. So we will see you then. Just want to say thank you again for joining today's webinar. I learned a lot during the session. I hope you did as well. Enjoy the rest of your day.
Thanks, everyone.
Bye, everyone.